everyone, welcome back to News Channel 5 Plus. We are hanging out here tonight with Jeremy Pitzer and Dr. Lucas Trautman. Jeremy, CEO, and of course Dr. Lucas, Medical Director. They're coming to us from Foundations Recovery Network, and we're having a great conversation tonight. The topic is one that, we all at this table feel is important. That's addiction, substance abuse, mental health conditions. It's something that I believe everyone has either a loved one or someone they know that has dealt with this. And, why not get the help that you need, the help you deserve, and the right help? And we're talking about the right help tonight. There's certain places that maybe go about it in a different way, but tonight we're talking about the right way with two experts in the field. Tonight is not just Ask the Expert, it's Ask the Medical Expert. So that's what we're going to do. Let's get to our next call. Are you ready?
Yeah.
All right, great. I believe we have Bob here on line 2. Hi, Bob. What's your question tonight for us here on OpenLine?
Well, I'm just concerned about the doctors and you and what kind of trouble are the patients in from the police, and is it germane treatment? And they have some, also do medicines out antiviral. The psychiatrists ought to be getting into that because the vibes can just tip a person over, back to alcohol and drugs, like a flu or something. But, is the watch on how much they take or how much they shouldn't even drink or something, the tip, or how germane is the treatment?
Great question, Bob. Thanks so much for tuning in and calling in.
This is such an interesting question because he brings a good point, thinking outside the box around treatment rather than just the medical model of disease versus medicine. There's so much research in gut bacteria, gut flora. People eating yogurt, our gut, our intestines carry a high amount of serotonin receptors. Serotonin's in the brain, and it's one of the neurotransmitters that helps us feel good. So when you have a lot of gut inflammation, it can really hurt your mood, and there's a lot of research on this. Alternative therapies that are becoming more mainstream therapies, like that.
Yeah, interesting.
Well, I'm really glad this came up too, from the standpoint that we have amazing food at the Oaks. I should say that it's a plug. We have really great food. A registered dietitian of our dietary staff, I think 4 of them are chefs, and so it's food and diet is such an integral part of overall wellness. I mean, that's also what he's saying, and I know that he believes that too. And so, yeah, it can't be understated that diet and what you put into your body really impacts the recovery process. So.
Definitely. While we have you here tonight, unfortunately, we're already halfway through the show. It's hard to believe. It always flies by. We have great guests and great conversation. What do you all want to talk about this evening while I have you here tonight? Just take it away. Anything on your mind that you really wanted to get across tonight?
What I see in a lot of my patients are caregivers, are really hardworking people who for many years have just pressed through their either depression or their addiction in order to care for others. And so what I think is so important, and what I preach so much, is to try to convince people that they deserve the treatment, to apply the compassion that they give to so many others, their kids or their grandkids, apply it to themselves as well, because they deserve it, number one. Number two, if they're healthy, then their grandkids are healthier and happier. So trying to encourage people and convince them that they're worth it. They're worthy of treatment and feeling good and not just having to press through more.
Well said.
Probably near and dear to my heart is the impact that trauma has on addictions. And so in the 90s, there was this really huge study called the ACE study, Adverse Childhood Experiences, Trauma, that looked at people's trauma and how that impacted them throughout their life. And what they found, in the initial study, and it's been replicated and expanded on since then, very, very, very valid, is that about 28% of children reported having physical abuse and 21% reported having sexual abuse. And 40% reported 2 or more childhood traumas. And then what that means is their development, their cognitive and physical development is impacted, which then leads to other behavioral problems, high-risk choices, and ultimately to addictions and early death, medical problems. And so trauma is, it's really at the center of many people's addiction, or it's underlying. And I don't want to sell a bill of goods and say that we're going to just resolve that, but we get people on the path of of dealing with their trauma. So we try to first identify what the traumas are and sort of develop a plan for long-term managing that. And then we do a lot of work around resourcing, which is cognitive coping, affective regulation, the mindfulness piece, giving them some of the skills to have the language and be able to discuss, the trauma and eventually overcome it.
Wonderful.
Function with it.
I want to ask, just as you were talking, I thought to myself, there's a lot of places, so we get as close as we can. There's a lot of places that they think they're doing it right, but they're not. What are things that you want people to know about tonight that are red flags when looking at certain facilities, and then folks like you all who are doing it right to look for? What are some things you want to stay away from when it comes to getting the right help you need, and what are some things that you all do that you can't find anywhere else that's just unique?
Well, I think we don't want to overpromise. You've had Siobhan Morse, our Director of Research and Clinical Director, just so many titles. You've had her on the show a couple times, and we really, one of the many things we pride ourselves on is our research department. And so our outcomes they're really, really strong. We see lower relapse rates and bigger times between relapse with our patients, and we're able to really look at a large sample size. So while somebody is in treatment, and then for up to a year after their last contact with them, we're able to sort of monitor that, and that falls into both the research and our alumni program. And so I would just want people to know it's a lifelong thing. We're going to stay with you for as long as we can, and we have many, many alumni that are in the program. Staying it by program, at that point they're just staying in contact with us for well over a year, and so that engagement with the community, and that includes the 12-step community, it's critical.
Go ahead.
Yes, I think this is such an important question. Like Jeremy said, I agree 100%. Another thing that I would add is when you're seeking treatment to see which is a good fit for you, looking for a place that's evidence-based is important, so you know that the outcomes will be strong, but also looking for a place that will meet you where you are. So some treatment centers have a rigid approach, where this is the approach and this is what we do. That doesn't work for everybody. A lot of people, they know themselves. They know what works for themselves. They want their family members to be involved in care. And that's what happens at the Oaks. We meet them where they are. Of course, we can present them with all the options and help them choose which one works best for them, rather than pushing one modality over the other. The second thing I would really look for, and it's kind of hard to look for on the front end, is the commitment and passion of the employees. We have that for sure. Our HR director, our business office manager, these are, our chef, are passionate people about addiction, and they're interacting with patients all day. So those two things I think are real important when seeking it out.
You know what I love is, I think now's a good time to share this. They have a phrase, or better yet, a purpose statement is what we like to call it, creating lifetime relationships for long-term recovery. That's their purpose statement. And I want you guys to kind of tell me the idea behind that.
Yeah, it's a great statement. It's a great purpose statement. I think the most important aspect of that is we are part of people's journey to recovery. And part of their recovery. And so we may get them on the front end, we may get them throughout their recovery, but it's a lifelong commitment. It's not doing treatment and then everything's fine, and you got to help people through that, because sometimes they think I can do my treatment, I can go to meetings, I can take my medicine, and then everything's fine, and that's not. It is a lifelong journey, and that's really what that's about.
We've used the word treatment a lot tonight, so let's kind of get deeper into that. Walk me through some of the treatment options. What are they?
Yeah, we have a continuum of care, all the way from sort of an inpatient detoxification, which not everybody needs, but many people do, that moves into residential treatment, and then partial hospital, and sort of really a continuum all the way down to outpatient treatment. So really wherever somebody needs to enter the system, they can, and we value this no wrong door approach. Whether they call us or they call somebody else, once they get to us, we're going to try to get them in the right place.
And that's opposed to detox and go home. Detox 4 days, go home, which has a low success rate. Yeah. We want to get them involved in new things they're passionate about. We want to help them work with their spirituality, their physical exercise, what they put into their body. We want to get them in touch with their therapist at home, set up a good psychiatrist at home, work with their family members, to where it's a lifelong commitment that we sow the seeds of at the Oaks.
Wonderful.
And we know the research is pretty clear that the longer somebody can stay engaged in treatment, and in the treatment community and the recovery community, the higher their chances of success are. So
let's talk about that conversation when you feel like you need to finally have it with a loved one. Just some advice tonight while we have you all here. What can you tell people is just a good way to walk them through? Maybe someone's watching tonight, I hope they are, and their son or their husband or is dealing with either addiction, mental health conditions, or usually they're tied in together. How do you have that conversation?
There's no really wrong way if you come at it from a place of love and compassion. You're never going to make suicide or mental health symptoms or addictions worse by talking about it. It can't possibly get worse, and so talking about it is the key, is to express how much you care about that person. And sometimes it takes 3 or 4 or 5 times of having that conversation to get somebody to agree. They have to hit their own bottom or one of their bottoms at some point and make that choice to go. And so it's important just to keep having that conversation and keep having that conversation. And yeah.
Another thing that's important, I think, in addition to that, is seeking support for the caregiver. So if the caregiver doesn't know how to talk about it, seeking resources, perhaps at an Al-Anon meeting, where they can meet other family members of people suffering from addiction, and they can have solidarity. They can learn about the common pitfalls and perhaps the way that could resonate with their son or daughter or spouse. And so caring for the caregiver is very important as well.
Wonderful. Great advice tonight. We're going to go ahead and take another quick break, but keep it right here on News Channel 5 Plus. We will be right back.